Yeah.
Hey, Mr. Bob Smith, how are you?
I'm well, thank you. How are you?
Good, good. So my name's Roger.
Hi,
I'm
Roger.
going to be your provider, and what we're going to be doing today is I'm going to be doing a physical assessment.
Okay.
So I'm going to get a good baseline of just health attributes, and then after that I'll be examining your gait and your balance.
Okay.
So let's go ahead and get started. So can you tell me what day it is today and what city you're living in?
Let's see. Today is Tuesday, the 5th of February, 2019, and I live in Seguin, Texas.
All right, perfect. Now what age are you?
I'm 62.
All right.
I'll be 63 in 2 days.
Fantastic. Wow, look at that. Hey, a lot of people say at 62 there's not much to look out for, but according to Texas Tech, you qualify to take this exam, so that's something, right?
There you go.
Awesome. All right. So would you say you have any trouble hearing?
Huh? No, I'm sorry. I'm joking. No, I don't have fine.
Okay. Well, let's examine that. So what I'm going to do, I'm
Okay.
going to whisper a word, and I want you to repeat it back, okay?
Okay. Train track. Red brick.
That's perfect. That's perfect. All right. So now I'm going to be assessing your breathing. So I want you to put your hand on one nostril,
Okay.
and then breathe in and out through the other nostril.
Okay.
One more time. All right. Perfect. Now go ahead and do it to the opposite. Perfect. That's good. That's
Okay.
good. All right. Now what I'm going to be doing is assessing your lymph nodes.
Okay.
Okay. So I'm just going to be palpating right over here.
All right.
All right. Post-articular, submandibular, and supraclavicular. All right. No inflammation, no signs of tenderness, so that's
Okay,
great.
good.
All right. Let's go ahead and move on. All right. Now I'm going to be testing your ocular movement, so
Okay.
your eyesight. So
Okay.
you see this pen right here?
Yes.
I want you just to follow it, okay?
Okay.
Okay. Try not to move your head
Okay.
too much. All right. How was that?
Seems
Is that
fine.
okay?
Mhm.
Good. All right. Now what I'm going to be doing is auscultating your heart and your lungs.
Okay.
Okay. So I'm going to be using this guy real quick.
All right.
All right. So the first thing you just sit still, and I'm going to listen to your heart first. All right. Can I move your phone real quick?
Yeah, sure. Mhm.
All right. So 3 seconds for each heart sound. Perfect.
Okay.
And then now I'm going to be listening to your lung sounds.
Okay.
So whenever I put my stethoscope on your chest, I want you to breathe in and then breathe out.
Okay.
All right. Can you raise your right arm for me? Okay. Breathe in. Okay. Perfect. Can you lean forward for me?
Yes.
So same thing. All right, perfect. All 5 lobes were clear, so that's
Good.
good. That means there's no signs of any sort of respiratory alignment, so that's
Good.
good. All right, now what I'm going to be doing is assessing your muscle strength from your head all the way to the bottom.
Okay.
So I'm just going to put my hand in front of you and back, and I want you to push back on my hand.
That way?
Perfect, yes.
Okay.
And then we're going to do the opposite, so push forward, good. Now let's do it to the side, perfect, and then opposite end. All right, good deal. All right, now can you put your hands out for me, okay, and squeeze my hands real quick, perfect, okay, now go up against mine, good deal, and then down, good deal.
Okay.
All right, so right here, put your hands in between mine and push outwards. All right, now I'm going to do the opposite, hold it right there, and then I'm going to put some resistance, and you just hold it, okay?
Okay.
All right, good deal. All right, that's perfect.
Okay.
All right, now let's move down to your lower extremities. So
Okay.
just relax a little bit, put your feet a little bit narrower, and I want you to just push up. All right, awesome, good. You can relax. And let's go ahead and assess your feet here.
Okay.
All right,
I'm
push
ready.
up against my, yeah, there you go.
Okay.
And down, and then just like the hands, go ahead and push against mine, and then feel some resistance.
Okay.
All right, that's awesome. That's perfect. So all of that checked out real well.
Okay.
All right, so now we're going to move on to the next test. We're going to do what's called the Tonetti assessment.
Okay.
So first I'm going to start by assessing with your balance. So just go ahead and relax in that chair. Looks like your balance is pretty good. So next thing I want you to do is go ahead and stand up. I'm going to do it right here.
Okay.
All right, perfect. Just go hold it right there. Good, nice and steady. I want you to put your feet about 4 inches apart. Do you use a walker or cane or anything like that? Okay, good. All right, now put him a little bit narrower. As narrow as you can. All right, perfect. I'm just going to assess your balance for about 5 seconds.
Okay.
I'm going to be right here. Okay. Good. Okay. So keep that position there.
Okay.
And what I'm going to be doing now is called the nudge test.
Okay.
So I'm just going to be pushing against your sternum a little bit.
Okay.
You just try to keep your balance, okay?
Okay.
I'm going to be using my palm.
Okay.
All right, you okay?
Yeah, I'm good.
Okay. 3 times. And then the exact same thing from the opposite. Okay, good. Perfect.
Okay.
All right, now just go ahead and close your eyes, and I'll be examining your balance
Okay.
in that position as well. Perfect. That's very good. Okay, now go ahead and sit down.
Okay.
That was perfect. That was perfect. All right, so there appears to be no issues with your balance.
Okay.
So let's go ahead and move on to assessing your gait.
Okay.
All right. Okay, Mr. Boston. So now what we're going to do is I'm going to be looking at your gait.
Okay.
So I want you to walk down this hall at
Okay.
a normal pace. And then once we get there, I want you to walk back at a little bit more rapid pace, okay? And then I want
Okay.
you to sit down. Is that okay?
Yeah, sounds
Okay.
good.
And if you have any issues while walking down there, just and if you need a break, just let me know. We'll stop,
Okay.
okay?
Sounds good.
All right, let's go ahead and get started.
Okay.
Go ahead and walk. All right, perfect. Okay. All right, good deal. Okay, go ahead and sit down.
Okay.
All right, so while you were walking, I was looking at the initiation of gait, the step length and height. step symmetry, step continuity, path. Your path was straight, your trunk was appropriate, and your walking stance was well as well. So all
Okay.
of that is perfect.
Good.
And the reason we conducted this Tenetti assessment is because falls are a big issue with older gentlemen.
Mhm.
So it's very important to get a good baseline assessment on your gait and balance so that we could address any issues before they turn into a significant problem. So
Okay.
that was the reason for that. And I'll also suggest other interventions that could prevent you from falling, such as the removal of rugs. But by looking at your house here, I noticed that there's not a lot of rugs, so that's
Mhm.
very good. There is some clutter there. It's my understanding that you just moved into this
Yes,
house.
in the
Okay.
process, yes.
Okay, so that's expected. But yeah, just whenever there's a lot of clutter, the probability of somebody falling is obviously higher.
Okay.
Right? And do you have any pets?
Yes, I have a dog.
You do.
Mhm.
What type of dog?
He's a German Shepherd, Great Pyrenees mix.
Oh wow.
It's actually my wife's dog, but
Yeah.
Yeah.
He sounds lovely. How old is he?
14 weeks tomorrow.
14 weeks. Fantastic. All right. So you know, dogs sometimes they can get in your path.
Yes.
Right? So it's very important that you also be aware of dogs getting in your path, and because of that, you will sustain a fall. Do you have any grandchildren?
Yes,
You do?
I do.
Oh, okay. Now we all love grandchildren, right?
Right.
But sometimes they can leave a mess as well, which can also increase your likelihood of falls. So if you ever do have them over, just make sure that you clean up after them.
Okay, will do.
Okay. And then you in your house you have adequate lighting,
Yes.
something that also helps to prevent falls. So that's very good. That's great. And earlier we went over your medications, correct?
Yes.
Right. And you told me that you had insurance and you had to wait to pay for your medications, right?
Yes.
Good. Okay, that's good. And if you ever do face any issues with obtaining your medication, just let me know or your provider, and we'll help you out as needed. Okay.
Thank you.
All right. Fantastic. Okay. So that's it. I appreciate your time.
Well, thank you, sir.